I believe our data shows that very low loads combined with direct pulse current are a viable training strategy for promoting skeletal muscle growth, as well as endurance. But in this case, not maximal strength. And I think we probably need follow-up work, and I'm sure Garrett's already working on projects looking at different clinical populations and the capacity of Neubie to facilitate strength adaptations.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow. Hello, NeuFit Nation. Welcome back to the Undercurrent podcast. And today we're going to have a presentation by Dr. Sam Buckner, a Ph.D. professor in exercise physiology at the University of South Florida. And you may recognize him because he's been on the podcast before. He was on episode 49 when he joined us back in the spring of 2022 to talk about the first published study looking at the effect of the Neubie on hypertrophy. And in that, he was looking at the acute response. In other words, looking at what happens immediately after a session on the Neubie with no external load, no weight, versus what happens immediately in the acute response, the aftermath after traditional resistance exercise. And he'll review that a little bit in this presentation, but he essentially found that the Neubie has a very similar acute effect as traditional resistance exercise. And that, of course, led to the question of, well, what about over a full training cycle? Does that actually translate into muscle growth over, say, an 8-week training cycle? So that was the next study that Dr. Buckner and the students in his lab pursued. And now that study has been published, and he joins us at the end of 2023. He joined our NeuFit practitioner mastermind call, which we do every month, in order to share the results of the study, talk about the study design, talk about what we learned from it, and what other discussion topics there are. What areas for further study, different things like that. So I will turn the floor over here to Dr. Buckner and this recording. One other note that he does share slides. So if you can watch this on YouTube, you'll get some extra visual input that might be helpful, but it should still translate by audio as well. So if you're in the car or walking as you listen to this, you should still be able to get virtually all of the information effectively. And I hope you enjoy.
Well, yeah, thank you guys for having me. It's great to be back. And this time with, in my opinion, is more robust data. It's cool to have a training study now on the Neubie to confirm, I suppose, what a lot of people have suspected regarding the application of the Neubie device. So this is just a screenshot of our publication. It's published in the Journal of Musculoskeletal and Neuronal Interactions, which I think is a great journal. We were pretty happy to get it in at this particular space. And William Hammert, I got to give credit to the students I work with. William, he goes by Blake, took the lead author position on this paper and did a wonderful job of drafting the manuscript. Let's see here. All right, just to kind of set the stage for what we're going to talk about today, and I pulled this from the introduction to the paper. One thing that my lab is particularly interested in is the idea that we have alternatives to traditional high-load training. So, a classic recommendation for skeletal muscle growth would be lifting 70% of your 1RM for 3 to 4 exercise sets, 2 or near failure. And we know that that's going to maximize the muscle protein synthetic response to stimulate muscle growth from exercise. However, the past decade, there's been a great abundance of research looking into alternatives that can also facilitate skeletal muscle growth. Things that can allow us to lift lighter weights, or in some cases, even no weight, and facilitate muscle growth. An example that we provided in the paper was Counts et al., which you guys will see referenced here. Counts et al. Was a study that I worked on during my Ph.D., where we had people lift no weights. They just pretended to lift weights and maximally contracted their muscles. And what we found is just contracting your muscle, almost like you're flexing in the mirror looking at yourself, caused muscle growth. The thing about this, though, is if you're maximally contracting your muscles while looking in the mirror, that actually takes a lot of effort. You have to think about it. You have to have that mind-muscle connection. But it did show us something that was interesting, and that's the fact that muscle growth seems to rely on internal tension. So the ability to contract your muscle, regardless, and what we think is independent of the actual external load or the weight that you're lifting. One thing we did notice in this study, by counts at all, was that there was kind of a heterogeneous response, meaning that not everybody in the no load group or the group that didn't lift weights seemed to be growing. Although at the group level, most people, or at the group level, the changes were pretty similar between a traditional training group and the no load training group. And this kind of, I think, sets the stage for, thinking about how the Neubie would lead to skeletal muscle growth and what protocols we could design. So that kind of led to our acute study that we ran. And again, maybe some of you are familiar with this paper, or even in my previous talk that when I visited y'all. But we looked at the acute response to Neubie training, and we compared that to traditional high load training in a bicep curl model. So we had people pretend to do bicep curls. I want to say pretend, they were lifting a little foam dumbbell. And we had the Neubie device on their biceps, and they performed bicep curls. And what we observed was a similar acute skeletal muscle response. And when I say acute skeletal muscle response, we are looking at indicators of muscle growth, things that might predict if you're going to grow over a longer time period. And what we looked at was muscle swelling. So, how big does your muscle get from pre to post exercise? We looked at fatigue. So how much force decrease do we see from pre to post exercise? We looked at a few other things, such as perceptual markers. How hard do people feel they were working? How much discomfort did they experience from the exercise, and these sorts of things? And we overall observed a pretty similar acute muscle response between the Neubie and traditional high load training. So if you lifted weights as people normally would in the gym, or if you lifted this foam dumbbell with the Neubie device activated, the response looked fairly similar, with maybe just some subtle differences in the time course. But overall, this led us to the suggestion that we think this is an anabolic response, and we think that over time, this would result in skeletal muscle growth. So we concluded that it might be effective for individuals. Particularly, we noted lower RPE during training with the Neubie, meaning people generally tended to indicate that they felt like they weren't working as hard with the Neubie compared to traditional high-load training. But we also noted that there was slightly lower discomfort values in the group lifting traditional weight. And again, we concluded that future research is needed to examine neuromuscular responses over longer. Sorry if you guys can hear my dog. And give her a treat. But we concluded that we need more long-term data. We need some training studies to confirm that these acute responses are in fact predictive of a long-term growth outcome. So it led to the aim of this study, which was to examine changes in muscle size following 8 weeks of what we called very low load resistance training with direct pulse current, performing 4 sets of 20 reps with around 10% of 1RM. And we compared this to a traditional high load resistance training, performing 4 sets to task failure at around 70% of 1RM. Other aims, in addition to growth, were to compare adaptations in 1RM strength, as well as local muscular endurance between these different training protocols. So this is the figure from the paper of our schematic, how we set up the study. Basically, individuals came in for strength and muscle size testing. We got a baseline muscle size of their quadriceps muscles. We measured their 1RM, and we did a local muscular endurance test. I think it was 40% of 1RM. They did as many reps as possible. We also familiarized them with the Neubie device during that first training visit. And our goal was to find the intensity on the machine in which they're performing exercise at a 7 out of 10 on a discomfort scale. And that intensity for us came from our previous acute work, where we determined that a 7 out of 10 appeared to be a good intensity for training in the context of our research. We use that number to kind of gauge where they should start their training when they begin the intervention. So visits 2 through 17, as you can see here, were the training visits. They came in, they trained twice a week on the knee extension machine. One of their legs was allocated into traditional training, and the contralateral leg was allocated into Neubie training, and then that was randomized. And then at the end, we had post-testing of all these same indicators to see how they adapted to the different protocols. One thing that we actually had a good bit of discussion about before employing the study was our first iteration, we actually had untrained individuals. And one of the reasons we thought untrained individuals would be a good population is because they grow the most. People who've never trained before have the greatest capacity to grow, whereas people who've been training for a long period of time, it's typically more difficult to squeeze out growth because there's a greater likelihood that they're reaching their potential or their upper limit of how much growth that they can accumulate. But after doing the acute study, you're looking in the immediate response, we were aware that people do get sore, in their first few training bouts. And we thought that recruiting trained individuals would provide more compelling evidence, meaning if trained people can grow, I think that's a very impressive thing for the Neubie device to demonstrate. And B, I think it circumvents scaring people away after the first few training sessions because of soreness and difficulty walking from the training protocols. And I'm sure some of you have experienced, again, when you try any new training modality, there's that kind of getting used to it phase and getting past maybe new muscle damage and these sorts of things. So we went with trained individuals for this study. We recruited 29 resistance trainings. They've been performing lower body exercise for at least 6 months prior to the beginning of the study. So again, maybe varying levels of how trained they were, but I do think it's pretty cool that we're able to conduct this in resistance trained individuals.
Sam, I appreciate all that setup there. Can you just talk for one moment about how and why you set up the each subject being their own control, and one leg using the Neubie, the other one doing traditional exercise? I know you touched on that there, but can you just explain a little bit more about kind of why you set it up that way?
Yeah. So within subject designs, I think there's a lot of benefits to them. You could argue that there's also some limitations, but when using a within subject design, you account for a lot of the variability between your groups because each person is their own control. So the only difference between the right and left leg is how they're training it. And since we know that muscle growth is a local response, meaning what you do on your left leg or is signaling muscle protein synthesis isn't really affecting your right leg, we thought that this was a powerful design, which would also allow us to increase our statistical power, meaning we have 29 individuals enrolled in the study, but that's 58 legs. So we have we have 29 comparisons. Whereas if we did a between subject design, each person would only contribute one condition. So we'd have to recruit double the number of participants to have the same number of comparisons. So yeah, that's another thing that I think we thought about for some time, weighing the positive and negatives of this particular design. And ultimately, I think you could probably craft an argument that, well, there's a crossover of strength when it's a within subject design, meaning strength seems to carry over more than muscle growth. But when both limbs are training, the crossover effect of strength seems to be drastically reduced. Meaning, if one leg didn't train at all, we would expect some crossovers of strength, but since both legs are training, we would anticipate that effect to be a bit less. Does that
Well,
clear
yeah,
it up, Garrett?
yeah, for sure. Thanks for. I thought it was worth drilling down for just a moment on that
Yeah,
because I think it's an elegant design about how each person is their own control. But yeah, appreciate that, and please continue on.
yeah. I will add just one more. I mean, we could give a whole talk on study design. But another wonderful thing about within subject design is you kind of account for differences in nutrition, because this within the same person, they're consuming the same thing. So you kind of take care of a lot of the criticisms that could exist. For example, if it was a between subject design, someone can say, well, are there differences in the dietary habits between group A and group B? But with a within subject design, we know within the person, both of their legs are being exposed to all these same conditions. So in that sense, I think it's a strength as well.
Yeah, that makes a ton of sense.
All righty. So this figure here shows our electrode placement for the actual design. And please excuse my illustration. I tried my best with the technology I had. So I drew this leg in PowerPoint, and it is a published figure. But we wanted to place the electrodes across the bulk of the musculature that we are interested in attempting to grow. So the vastus medialis, rectus femoris, and vastus lateralis. Like I said, one leg was assigned to direct pulse current. The other was assigned to the traditional training protocol. The Neubie device was set to 55 hertz, after which participants were asked to perform 5 to 10 knee extension repetitions at approximately 10% of their one arm. And this is for the familiarization. And during the familiarization, where we're just, it's the first time on the machine, we're cranking up the intensity and finding that intensity at which they indicated that they're at a 7 out of 10 on the Borg discomfort scale. And just to give you all an idea, 10 on the Borg discomfort scale is supposed to be kind of maximal pain. 7 is pain or discomfort, but not quite pain. So we kind of wanted to push the level to that 7, which, from our pilot work and from our acute study seemed to indicate we'd be giving them a good intensity to hopefully facilitate muscle growth. So we employed an 8-week training program. They came to the laboratory twice a week. It was all supervised sessions. Both legs trained each session, with the leg that trained first alternating. So we alternated which leg started. And they did 4 sets of unilateral knee extension exercise under the condition that whichever leg was randomized to that condition went first. The direct pulse current performed 4 sets of 20 reps, or as many repetitions as possible, whichever came first. In most cases, individuals were performing all of the reps. There might have been a few individuals that were reaching failure prior to 4 sets of 20 in their earlier training sessions. But as time went on, people were generally getting all the repetitions. We had 30 seconds rest in between exercise sets. And we kind of, we can consider this maybe a slight adaptation on some of our blood flow restriction protocols. Blood flow restriction uses light loads, it restricts blood flow, and we use 30 seconds of rest because we want to kind of accumulate fatigue across exercise sets. So our thinking was somewhat similar here when employing the protocol. We wanted fatigue to happen, and we wanted that fatigue to carry across sets. Because again, we're not relying on a external mechanical load to compress the vasculature, to cause the fatigue. We're relying on internal tension to facilitate all of these things. So direct pulse current was applied during the exercise protocol, and we decreased the intensity just a little bit during the rest periods. The traditional training protocol, they did 4 sets of exercise to task failure with a load equal to 70% of 1 RM. They rested for 60 seconds in between sets, and the load was adjusted to allow for 8 to 12 reps to be completed for each exercise set. So this is just a very traditional hypertrophy training protocol. 70% of 1RM is the most traditional hypertrophy training zone. 8 to 12 reps is that rep range that we're typically looking for. So the reason we went with this is considered the gold standard of hypertrophy training, 70% of 1RM, 8 to 12 reps. And we wanted to compare Neubie out the gate with something that we knew was robust. So we have resistance trained individuals, we have a within subject design, and we're comparing it to the gold standard. Or at least in my opinion, what would be considered the gold standard in the literature. All participants were instructed to perform each repetition to the beat of a metronome at a cadence of 2 seconds per contraction, 1 second up, and 1 second down. And because task failure was considered the inability to complete the concentric phase of the repetition, the final repetitions before exercise were sometimes performed at a slower pace. So we were very confident that individuals were fatiguing, they were reaching failure. I think we've gotten pretty good at that in the lab. And how we assessed our outcomes. My laboratory specializes in the use of B-mold ultrasound for skeletal muscle growth. This is actually a picture of our ultrasound unit. We measured muscle thickness at several different sites. And here I'm going to share what we found at these different muscle sites and maybe explain to y'all why we measured at so many different sites. But we measured at 40 and 50 and 60% on the anterior thigh. So if I go back, I can kind of give you guys an idea. It wouldn't be diagonally, but it'd be measured straight across the muscle. Can you guys see my cursor on the screen? Is it showing up?
Yes, we got it.
Okay. So and maybe this pen will work too. Oh yeah, so we measured, it's about here, I'd say here and here across the front of the leg. That's where we'd measure muscle thickness. Did it show up? Maybe it didn't.
Yeah, I can see it on our screen here.
Okay, cool. So we measured muscle thickness at those sites. And what we found was at that first site, we actually didn't have muscle growth in Neubie condition, and we think we know why. So the 40% muscle site, there was an interaction. The traditional training protocol increased muscle size from pre to post, whereas the direct pulse current did not increase. But for the 40% and the 60% sites, the 50 and 60% sites, there was no interaction. And what an interaction essentially means is it means that your conditions changed differently over time. When we looked at those two muscle sites, there was no difference. And we had fairly robust muscle growth in both conditions. Mean changes, if I look here, of 0.24 centimeters, which it's on par with what we'd expect to see, and 0.25 centimeters of muscle growth. And if you guys ever pulled out a tape measure, you could look at a centimeter and there's those little lines in between. 0.2 is about what you'd expect to see over 8 weeks time. And that's what we saw in both the traditional and in the direct pulse current or the Neubie training condition. When we looked at the lateral muscle thickness sites, also no interaction. And again, no interaction indicates that time had a similar effect on both of our conditions. There was a main effect for time, meaning that over time, both groups increased and they increased to a similar extent. And we had a medial muscle thickness site as well, no interaction or main effect for protocol. There was a main effect for time. Muscle thickness increased from pre to post, a mean change of 0.21 centimeters. So again, what this is highlighting is that there was muscle growth, and at all but one site, that muscle growth was similar between our traditional high load condition and our Neubie condition. And the 40% site, we were speculating as a lab, we were sitting down, we're like, okay, everything looks remarkably similar here, except this top muscle site that we measured. And we think that top muscle site was just too far from the electrode. So we think if we did this study again, we'd maybe refine our electrode placement. Another possibility, just to let you guys inside of how our minds work.
If you're ready to supercharge your practice, listen to this. Garrett and Team NeuFit have just released a new online course entitled Introduction to the NeuFit Method. In this detailed 8-hour course, you'll gain mastery of the fundamental techniques in our practice, including muscle testing and activations, nerve glides, and joint articulations. You'll also get introduced to our patented direct current stimulation device, the Neubie, an incredible machine that's empowered professionals just like you to help their patients heal, adapt, and grow faster than they ever thought possible. To learn more, go to www.neu.fit/learn. And now back to the show.
The 40% site is towards the top of the muscle. And honestly, my reliability is just not quite as good as the muscle tapers and gets to tendon. So some of that might just be that's not as good of a site to use for measurement. We definitely have better reliability and a better ability to measure growth kind of in the middle of the muscle belly, I would say. So again, I think overall for me, as a researcher, this indicates remarkably similar growth between both training conditions, which we thought was pretty cool. I mean, we had suspected it based on our acute data, but it was really nice to get this confirmation over 8 weeks in a resistance trained population. As for strength and endurance, we see some slightly different things here. So we measured maximum strength in a knee extension exercise, the exercise in which they trained on. And there was an interaction. And what that means, if there's an interaction, that means, again, that time had a different effect on our protocols. In the traditional training protocol, increased one arm strength from pre to post, average change of 10.2, but the direct pulse current did not increase from pre to post intervention. The mean change was 1.04. And then for local muscular endurance, no interaction, main effect for time, meaning they changed similarly. The number of repetitions increased for both training protocols with a mean increase of 5 reps. So as far as endurance, the adaptations were pretty similar. However, maximum strength was not. And I think what we have to consider here is, one thing that we've come to learn about strength adaptations is that they are specific to how we test them. And maximum strength, it's really difficult to get strength to increase without having exposure to working with an external implement. Meaning, we only had them ever, it's 10% of their 1RM, even when training with the Neubie. So they produce that internal tension, but they weren't getting that neuromuscular stimulus, I believe, to facilitate the strength adaptation. Now, I think we have to be careful on how we use this data because, I would suspect a lot of you are working with individuals who are maybe rehabilitating from an injury or trying to regain their baseline strength. So I don't think we can take these findings to mean that the Neubie can't increase strength. But if you're young and healthy and have been habitually lifting, and then you switch to Neubie training, in those circumstances, you'd probably need some supplemental exposure to a training load in order to facilitate a strength increase. At least that's how I would kind of interpret these findings. As far as the endurance, that was similar, and we did the endurance test, I believe I want to say 40% of 1RM, and just repetitions to failure. Similar adaptations there. And, endurance is one of these elusive things where I don't think we perfectly understand the mechanism that drives increases in local muscular endurance. There's been some suggestion that it's mediated by maximal strength, but that certainly wasn't the case in the present study. So I'm open to suggestions. Some people would say that endurance is maybe influenced by the muscle growth response, but I wouldn't be confident to make that suggestion either. So when discussing our findings, I think the main finding was that the application of direct pulse current to very low load knee extension exercise was similarly as effective for increasing muscle size as a traditional resistance training protocol. In addition, both protocols demonstrated an increase in local muscular endurance. However, the traditional training showed greater increases in 1RM strength. With respect to RPE and discomfort, and I didn't really touch on this data, but I think it's worth noting, we found that both protocols elicited increases across exercise sets. And they're pretty similar. So if we looked at the exertion, we looked at the discomfort, it wasn't really different between our training protocols, which is interesting, right? Because certainly the exertion required for newbie training is not the same as being required to actually lift an external load. But people still perceived it as working hard. And then discomfort, was by design high in the direct pulse current, because that's kind of what we set as the intensity marker. So we want you to 7 out of 10. And I think overall the discomfort was just below 7. But again, by design, that was meant to be higher. So in conclusion, and I hope this data is clear to y'all, and I hope I can clear up any questions that you might have. I believe our data shows that very low loads combined with direct pulse current are a viable training strategy for promoting skeletal muscle growth, as well as endurance. But in this case, not maximal strength. And I think we probably need follow-up work, and I'm sure Garrett's already working on projects looking at different clinical populations and the capacity of Neubie to facilitate strength adaptations. This form of training also appears to require a similar degree of effort and is accompanied by levels of discomfort compared to traditional high load training. Future studies are warranted to examine different combinations of external load under direct pulse current. So I think there's still a lot of opportunity for study design and inquiry using this device. Our lab has certainly had a fun time exploring different protocols. And as someone who has a general curiosity around skeletal muscle growth and adaptation, I think this is a pretty cool tool. So with that, I guess I'll open it up to questions and see if you guys have any for me. But hopefully that was a nice, clear overview of the study that we did.
Yes, thank you so much, Sam.
Yeah.
I've got a couple, but want to give anyone else an opportunity before I chime in.
I actually have a question.
Yeah.
So Dr. Buckner, I missed it, but what position were you actually? Was it an upright position, or did you have him doing the knee extension, from a seated position, just like you were doing the extensions with the traditional, or
it was
an
a seated
isometric hold and squat, or how were you doing this?
We used a seated knee extension machine. Yeah.
So that was traditional and with the Neubie.
Oh yeah. They performed both exercise conditions on the same machine. One leg would go with a heavy weight, if let's say traditional went first, and then we'd switch the weight to 10% of the 1RM. So they would lift the lever with just a really, really light weight.
I see.
And we'd crank up the Neubie device. Yeah.
And when you said they were alternating which leg started, it was the one leg would do all of its sets and then switching, the other leg would do all of its sets, right?
Yeah. In research, that's typically how it's done. We'll do all 4 sets for one leg. And that's just because in research, you're trying to maximize the response you can get out of that exercise. And the cleanest way to do it is just focus on one muscle and then switch to the other leg. So yeah, we do all 4 exercise sets, track the rest, and then move on to the other leg. Yeah.
All right. Any other questions?
Dr. Buckner, I really appreciated when your initial discussion of the setup talking about that crossover, because that's a question that I've gotten a few times since the hypertrophy study has been released, is that issue of if you have trained individuals and you're looking at 2 different legs, like how that's going to cross over. So that's really interesting. Have you seen in other studies that you've done, like any instances where you would see that crossover? Or is that's kind of that's something I certainly didn't know, that you had this very localized muscle growth that wouldn't have any impact on the other limb.
Yeah, I think so you're talking specifically the potential of growth to have a crossover?
Yeah. Mm-hmm.
Yeah. I'm not aware of that occurring in the literature. The concern is typically strength. And I think I haven't read this literature in a while, but I'm gonna say what I think I remember. And it's more so stuff to do with like bed rest, and if you're in a cast and you do and I think there might be a place for this low level stimulation might help not grow a muscle, but slow the loss of a muscle.
Right.
I think there might be some potential there, but I'd be hesitant to say that it's providing a robust enough stimulus for actual growth.
Right. So in the same vein, like actually our director of fitness at our clinic here in Austin had this question when we talked over the study. It was, if you're doing on a leg extension machine and you have one leg going, that other leg, even though it's theoretically not doing anything, if you're using any sort of, core musculature or anything to kind of like brace yourself for that one leg, he was wondering if that would impact at all. But in that case, you would probably have both legs getting that same thing, because when you switch to the other side for the other training paradigm, you would get the same response.
Yeah, and I would add in the population that we're looking at in this particular study, which I realize isn't the population that everyone in the clinical study is working with, but if you're resistance trained, the stimulus it takes for growth, even if there is some crossover, which let's just say that the potential is there, the anabolic response you'd get from mild activation, because I've heard it said that it's impossible, if you maximally contract your right arm, you're getting some activation in your left, right? Because it's called decussation. Not every nerve crosses over like it's supposed to, from right side to left side or left side to right side. So you always get a little bit of activation, but then we know the stimulus for growth is more robust than that. And especially if you want a maximal growth response, you have to activate those muscle fibers, and you have to fatigue those muscle fibers sufficiently to stimulate that muscle protein synthetic cascade. So yeah, I mean, I think we could craft an argument if we wanted to suggest that could play a role, but it wouldn't be able to play a large enough role to lead to similar growth between the two, both legs, essentially.
Thank you. Yeah, I agree.
Yeah.
I would be curious to talk for another moment about both the differences in strength and local muscular endurance. So for starting with strength, one of the things that we talk about, and I'm wondering if just kind of making a hypothesis, you can let me know if you think it's reasonable or there's a better explanation, or whatever you think. But we would say that if we're working with a power lifter, for example, who wanted to use the Neubie, that generally you can use the Neubie and get a lot of similar muscle stimulation, but at some point you're going to have to touch heavy weights, because, like, for example, if you're talking about your squat, you could be loading with the Neubie your glutes, quads, hamstrings, etc. But if your spine is not getting that axial loading for a long enough period of time, those mechanoreceptors are essentially going to, freak out. I'm not going to use a technical term, right? But they're gonna when they sense 600, if they believe they can only handle 450 pounds, and you throw 550 or 600 on, those spinal mechanoreceptors are going to basically send a massive signal, shut down your nervous system, and go into protective mode and stuff like that. So it's, we kind of think that something about the mechanoreceptor activation is relevant there. Any thoughts on that?
Yeah, I think it's just important to consider our design gave minimal exposure to any type of load. And I think some people that are using Neubie are probably using it in combination with loads, which I think would lead to a different outcome. I also think it's potential, we would have potentially found a different outcome if we would have just had some periodic exposure to lifting heavy. There's a study, I think it was 2016 by Morton et al., and they compared low loads with high loads, and their previous study found that low loads underperformed compared to high loads for strength adaptations. But they added in one maximal lift a week, just one, and it led to similar strength gains over an 8 to 12 week time period. So I think if we would have provided even just a little bit of exposure to an external load, along with the direct pulse current training, I think there's a good chance that we would have observed similar strength. So again, I think that just highlights, Garrett, the fact that there's a lot of opportunity to look at different things through study design. I will also add that given that we didn't give them that opportunity to practice external loads, I wasn't surprised that we didn't see the strength. So the potential is there. I think the potential has to be aligned with the skill acquisition component, and like you said, I think maybe the powerlifting example, there's a lot of skill also involved in that movement that you need to have that proprioception with the weight along with the muscle activation. So
Yeah, well, that's citing that Morton study. That seems very relevant and a compelling point there. So thank you for sharing that. I think that's a great insight.
And I'll add that, the reason we avoided the external load completely is because our goal here was to test direct pulse current. And I would argue our primary concern or interest in this study was the potential for growth. So in a lot of ways, we minimized any potential to see strength, so part of that I would consider is by study design, and trying to minimize any external influence outside of the treatment itself.
Okay, that makes sense. Also on that topic related to study design and strength, how relevant might the differences be between the group that did traditional resistance exercise and made it to failure versus the ones that were using the Neubie? You said a few of them had trouble getting through all 4 sets of 20 in the beginning, but eventually they all did. And I imagine many of them had reps left in the tank at the end of those 20. So is there any relevance there that could have any connection there between what we saw with strength?
I think I'd implicate the proximity to failure is more so related to growth than strength. Because you could do 5 reps on a 10 RM and acquire strength adaptations, but you need to get all the way to 10 to acquire the muscle growth. So if anything, let's say some people were farther from failure with direct pulse current than others, which is really hard to determine, right? Because with such a low external load, 10% in this study, is it possible to fail, right? You're relying on internal tension and not overcoming an external load. So what's our limiting factor? And for those individuals that did end before 20 reps, I think it was just the discomfort they were experiencing. But I don't necessarily think that was a limiting factor on our strength. If anything, maybe it would explain some of the discrepancy at the 40% site for muscle growth. Maybe if we would have tried to push people a little harder. But again, I think that's another area where we can probably refine our approach. And I'm sure some of the practitioners are probably more refined in their approach than we are as a research lab because of how much experience they have. But maybe we could double the volume. I don't know. We use this as a protocol that we thought is reasonable, and I still do think it's reasonable. But it does become more difficult to gauge what is our proximity to failure, knowing that that's an important factor with regards to growth. Now with strength, I think the combination for strength is just going to be increasing that external load a little bit over time. How high does the external load need to get to facilitate the strength? I'm not really sure, but I think that's what would lead to those adaptations, or adding in just supplementary work where they touch some external weight for a very low volume. I think that would also equalize the strength outcomes.
That makes sense. And this is, I'm essentially getting to learn along with everyone else. This is the first time I've gotten to discuss the study in depth with you here too. So, some of these questions are just from my own desire to better understand and learn. And I think those are great insights. So I would, from everything I've heard and certainly read the study and all that, I agree. It seems like a very reasonable design. Obviously, there's always a trade-off with every decision, and for what it's worth, it seems like you and your team made the right ones here. So I appreciate that insight and the work overall and that insight on strength. Talking about getting to failure is a good segue into the muscle endurance question. So you mentioned, max strength and some of the size, the growth in muscle size being implicated. Might there be any effects in terms of anaerobic energy processing, or ability to use lactate as fuel? Or what are some of these other things that could be related to that local muscular endurance?
Yeah, I think that outcome could be an indicator of peripheral adaptations that aren't necessarily captured by muscle growth. Increased capillarization, increased substrate utilization, just things that we didn't measure that I think could potentially explain increases in local muscular endurance. The two things I've looked at previously in research, trying to understand what drives an increase in endurance. There's a paper by Matt Jesse that suggested that it's mediated by changes in strength. We didn't have similar strength, but we had similar endurance in this paper, so that kind of refutes that hypothesis. But I also kind of think of endurance as performance, and I think of endurance, part of our thinking was at 40%, the overall repetitions you're performing is going to be more similar to the direct pulse current protocol. So in a way, maybe we would consider that the endurance test was more specific to how the direct pulse current group trained, right? So they trained with high reps. They did 4 sets of 20. And even though they weren't lifting a weight, they were training to do higher rep and high force contraction, because even though they're not lifting external load, they're producing internal tension. So I think we can almost consider, and maybe it's a stretch, I don't know, the local muscular endurance test, we tried to not appeal to the specificity of training to either group, but I think you could certainly argue that it's closer to how the direct pulse current trained as far as reps. So maybe on some level, it's driven by just the specificity of contraction to some extent. I don't know if that makes sense, Garrett, but I'm kind of thinking out loud here on potential things that would explain it. And
there may have been some carryover from the 4x20, even though it's a 10% rather than 40%. Yeah, that makes sense. In terms of, I know we're talking about local muscular endurance, local being peripheral in the muscle. Are there any central factors? I'm thinking of, this paper from, is it Timothy Noakes, the guy who writes about fatigue as being a central governor, and how, the brain's output, fatigue could be essentially an output, a feeling or emotion of the brain, like hunger drives us to eat, thirst drives us to drink, fatigue drives us to stop doing something, or the absence of fatigue, some of that drive from the brain. What if any interaction might there be in terms of that type of endurance and any central effects?
Yeah, so obviously we didn't measure any of those, but I think it could be playing a role. As far as governing fatigue, maybe it's more psychophysiological, right? So when you train for 8 weeks at a relatively high level of exertion and discomfort, I think there's, and I believe this plays into performance, just developing more of a grit, an ability to push through discomfort, push through pain. And I think that would relate on some level to a central adaptation. And I wouldn't be able to perfectly explain it, but I would just classify it as psychophysiological. So I think there might be a psychological aspect too, to having gone through this protocol, right? Experiencing discomfort, experiencing high levels of exertion for 8 weeks, twice a week on the same exercise, and then performing better on that exercise. Some of it's probably related to just the ability to push harder, which I would label as psychophysiological. But along a Noakes line of thinking of central governor theory, you know, I don't know what adaptations would be taking place at the level of the brain to explain it. That might be a bit beyond my scope, but I certainly wouldn't rule out that there is some type of central adaptation. And I think, you know, again, central is implicated probably more with strength, for strength adaptations and increasing your ability to recruit motor units and these sorts of things. But I would be tempted to say that any benefit there is psychophysiological. I would lean towards.
I love how I can suggest something and then you can not only give the scientific basis for it, but explain it much more elegantly and eloquently. So I appreciate that. Thank you very much.
Yeah, I tried my best. Definitely not a perfect answer.
Well, it's a good scientist's answer. He acknowledges it's outside of his scope of expertise, but he can give an informed opinion because he still knows more about it than 99% of everyone else. And that's good. So I think so Dr. Linda Denny wrote in when we were talking about the crossover effect. She mentioned that was related to atrophy, and the first studies were in rabbits in casts, looking at crossover training and how it reduced some of the atrophy. And we got a few people logging off and saying goodbye here. So we are at the top of the hour, so we'll go through, do a little bit of our Q&A for people who had submitted questions. But Dr. Buckner, I think we'll excuse you for the evening, and thank you so much again for coming on and sharing the study with us here, doing a deeper dive, and generally for the work that you're doing with your students and in the world and in your laboratory. Just thank you for your contributions to science, and it's an honor to work with you.
Yeah, same. Thank you for having me, and I appreciate everything that you guys are doing.